Hello guys, Vanakkam and welcome to Meet Nash Academy, one of leading academy in training nurses in the nursing competitive exam as well as IELTS, NCLEX and OET training. Welcome back to one topic maximum mark session. Here we are going to select one topic which is asked many times in the competitive examination, and also we are going to discuss the MCQs related to that particular one topic and additional golden points also we are going to discuss. So watch the video till the end. Definitely it will be so much useful for you for your upcoming NORCET examinations. Okay, so if you're watching the video for the first time, please subscribe the channel, and if you like the video, please like it and share to others also. Let's start the session with your thought of the day. Remember that failure is not the opposite of success, it is a part of the success. Failure is the stepping stone for the success. Without failure, you cannot reach success. Okay, so don't worry about the success. Keep on trying is very, very important. So with this thought, let's move on to the session. The topic what we are going to discuss today is most demanded topic from the students. Yes, guys, that is nothing but occupational hazards. In each and every competitive examination, we are getting questions from occupational hazards. So knowing about occupational hazards, the type of occupational hazards, which part of the lung is going to get affected, what are the symptoms, these things are asked many times in the competitive examinations like NORCET. So watch the video till the end. See, so these are all the list of what? Occupational hazards. See, respiratory occupational disease exam points, a brief review you are seeing now. Okay, so here you can see this is the disease and occupational exposure, part of the lung affected, and exam point. In a single slide, I have covered each and everything. Okay, after this slide, we are going to solve some MCQs also. So watch the video till the end. That is very important. So you can see many diseases here, like silicosis, asbestosis, bicyanosis, coal worker pneumoconiosis, farmer's lung, bagosis, berylliosis, sidrosis, stenosis, and barytosis. These diseases are commonly asked in the competitive exam. Let's discuss one by one in this fast track session. So silicosis. So who will get this disease, silicosis? Those who are working in mining, sand blasting, that is in quarries, sand blasting will be there, no? So in that sand blasting, stone cutting, in this area, if a person is working, means they are prone to expose to silica dust. So once they expose to silica dust, this silica dust is going to accumulate in the upper lobe of the lungs. Where it is going to accumulate, that is very important. In the upper lobe of the lung, it is going to get accumulate. You can see here. Okay, so if the upper lobe of the lung is damaged, and in the X-ray it is showing X-shell calcification. What shell calcification? X-cell calcification. You have to think about what? Silicosis. Okay, so these are all the key points. And second one is asbestosis. Those who are working in construction, shipbuilding, otherwise insulation, this area, this asbestos exposure is very, very common. So those who are working in this area are prone for what? Asbestosis. So in asbestosis, which part of the lung is going to get affected? The lower part of the lung is going to get affected. This is another important part. The lower part and pleura, these two things are going to get affected. Understand, guys, right? So key points, only key points we are discussing. Okay, the next one, bicyanosis. What is that? Bicyanosis. Already this question asked many times in the exam. Those who are working in the textile industry, for example, those who are frequently exposed to cotton, flax, hemp dust. This flax and hemp dust are nothing but it is a plant product. Okay, these things are very useful in making the textile dress. Okay, right? So if the person is frequently exposed to cotton, flax, hemp dust, that time the patient can go with what? Bicyanosis. Here airway is affected. See, the lobes are not affected in the bicyanosis. The airway is affected. That is very important point. Okay, this bicyanosis is also called as Monday fever. In the starting of the day, after Saturday, Sunday, Monday, the person is going for the job and exposed to this kind of cotton. That time the patient will be having chest tightness. That's why it is called as what? Monday fever. Here airway is affected. Please remember this. Very important question. The next one, bronchoconstriction will take place in bicyanosis. And the next one is coal worker pneumoconiosis. Those who are working in the mining, coal dust will be exposed. Okay, so in this area, the upper lobe is going to get affected. Okay, right? See, if the person is working in mining, that is in coal mining, the coal dust exposure will be very common. In that situation, the upper lobe of the lung is going to get affected. Understand, right? So in silicosis, upper lobe is affected, and in coal worker pneumoconiosis, the upper lobe is affected, and in the asbestosis, the lower lobe is affected, and byssinosis, the airway is affected. Okay, the next one is former lung. What is that? Former lung. In former lung, what is affected? See, in former lung, you have to think about what? Moldy hay. Moldy means fungus. Moldy means what? Fungus. Hay means the old grass. Okay, see, they are dumping the old grass in the storeroom. So from the old grass or dried grass, a fungus formation will be there. That fungus is going to enter inside the lungs of the person, those who are working in this farming area. Then they will be getting the disease. That is called as what? Farmer's lung. Here, which part of the lung is affected? Alveoli. See, this is alveoli, and the surrounding layer, the layer which is surrounding the alveoli is called as what? Interstitium. Okay, so alveoli and interstitium both will get affected in the former lung. Understand, right? So here the exam point is the alveoli, interstitium, both are going to get affected, and it will cause what? Hypersensitivity pneumonitis. Hypersensitivity pneumonitis, that is the key point in the former lung. The next one is bagosis. Bagosis also repeatedly came in the competitive examination. In bagosis, you know that it is caused because of what? Sugar cane dust. Those who are working in sugar cane industry, they are prone to get what? Bagosis. Here also alveoli, interstitium, both are going to get affected. Here also it will cause what? Hypersensitivity pneumonitis. The next one is berylliosis. Okay, right? So here what is happening in the berylliosis? Beryllium, the person who is exposed to beryllium chemical. This chemical is commonly used in the aerospace. Okay, so if they are exposed to the beryllium, here what is happening? Beryllium is the light metal. It is going to accumulate in the lungs. So once it got accumulate in the lungs, the macrophage cells try to remove this, but it is very light but strong, so it cannot be removed by the macrophage cells. So the light material will be covered by the macrophage cells. That is called as what? Granuloma. So granulomatous lung tissues you can expect in the berylliosis. Understand, right? So anywhere in the lungs, these granuloma tissues will be formed. It is not like only upper lobe, only lower lobe, only airway. It is nothing like that. Anywhere in the lungs is going to get damaged. That is called as what? Diffuse interstitium. And what about siderosis? Siderosis means iron oxide dust. Those who are working in welding, those people are prone for iron oxide dust. Here it is also called as welder's lung. What lung? Welder's lung. Here all parts of the lung is going to get affected. That's why it is called as what? Diffuse. The next one is stenosis. Those who are working in the tin mining or smelting, so those peoples are prone to get affected with the stenosis. Okay, so here it is caused by tin oxide. It is also a chemical. Here also all the lung part is going to get affected, and it leads to fibrosis. This fibrosis is also called as what? Benign pneumoconiosis. What is that? Benign pneumoconiosis. And the last one is baridosis. See, it is caused because of the barium sulfate. Here also all over the lung, all the parts are going to affected. That's why it is diffuse. So it is also causing what? Fibrosis. That's why it is called as benign pneumoconiosis. So these are all the important brief review about the respiratory occupational disease, and the summary I have given here. Okay, no issues. I'm going to solve the question. See, this slide is very, very important. Before the examination, you have to watch this video. Okay, right? So the next one is MCQs, which is related to this particular topic. A 45-year-old stone cutting worker. See, already I have informed in many videos. In each and every question, you have to find out the key points, and also the last sentence of the question is very, very important. Here also I have highlighted some of the key points in the question. Just focus. A 45-year-old stone cutting worker has progressive dry cough, exertional dyspnea. In chest X-ray shows small rounded opacities, predominantly in the upper lobe. So upper lobe is affected. Stone cutting, for stone cutting worker, see, stone cutting work is the profession of the person, and his upper lobe is affected. He is having dry cough and dyspnea. Okay, so which occupational disease is most likely? So this is the question. Already I have explained everything, in which condition the upper lobe is affected, which condition airway is affected, which condition lower lobe is affected. Everything I have explained. Now you have to answer. 4 options they have given here: asbestosis, silicosis, byssinosis, former lung. So in which disease, occupational hazard, the upper lobe is going to get affected? The right answer is silicosis. So the person working in stone cutting worker, while cutting the stone, what will come out? What will come out? Silicosis will come out. The silica will come out. It leads to silicosis. The silica will come out. It leads to what? Silicosis. Understand, right? So you can see the rationale. In asbestosis, already I have explained, the lower lobe is going to get affected. In silicosis, the upper lobe is going to get affected. Okay, right? And also the person who is working in mining, stone cutting, sand blasting, silica will come out. It leads to what? Silicosis. Upper lobe is going to affected. Byssinosis is totally different. It is related to cotton dust, right? And farmer lung, it is also totally different. Those who are working in farming, those who are storing the hay, 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 that is dried old grass. That time the fungus formation will be there. The fungus will go inside the lungs and it will cause what? Former lung. Okay, so this concept is also totally different. So at last the right answer is going to be what? Option B, that is silicosis. The next question: a 50-year-old man working in stone quarry has silicosis. So diagnosis already done. Silicosis diagnosis is done. During follow-up, the nurse explained that he has an increased risk of developing which infection? So already one diagnosis is done, that is silicosis is present for the patient, and during follow-up, the nurse explains that there is an increased risk of developing which infection? So they are asking about infection. TB, malaria, hepatitis B, tetanus. 4 options they have given here. For silicosis patient, which infection they are prone to? This is the question. And here the right answer is option A, that is TB, tuberculosis. Why? Why? You should ask why. You can see here, in tuberculosis, why tuberculosis for silicosis patient? See, silica impairs the alveolar macrophage function. Okay, so you know that alveolar type 2 collagen is present. The function of the collagen is macrophage. But this silica is going to destroy the macrophage function. It leads to prone for infection. Which infection? TB, Mycobacterium tuberculosis. Understand, right? For silicosis patient, TB is very, very common. The next one is malaria. Malaria is not related with this condition. It is caused because of what? Anopheles mosquito, and it is unrelated to silicosis. Hepatitis B, it is totally different. Here it is transmitted by the blood and body fluids. The lung is going to get affected. Tetanus, it is caused because of Clostridium tetani, which entering the open wound, right? And it is also related to, not related to the silicosis. So here the right answer is what? Option A, that is TB, tuberculosis. The next question: a 62-year-old retired construction worker present with progressive dyspnea. He worked at the asbestos containing material for 30 years. The chest image shows bilateral lower lobe interstitial fibrosis. Which condition is most likely? From the question itself, they have given the answer, right? So they worked for 30 years in the asbestos containing material. So definitely the patient will be getting what? Asbestosis. Okay, so here the right answer is what? Asbestosis. So silicosis, it is common in the stone cutting area, stone blasting area, quarry, mining area. Asbestosis, so those who are working in asbestos containing material, they are prone for asbestosis. Coal worker pneumoconiosis. This disease is commonly seen among what? Coal mine dust. Those who are working in mining area, the coal is going to accumulate in the lungs, especially in the upper lobe of the lung. That time coal worker pneumoconiosis will be there. Byssinosis is totally different. Already we discussed about this, right? So for this question, the right answer is what? Asbestosis. See, asbestosis, the main key point is the lower lobe of the lung is going to get affected. You understand that? Okay. So the next one, a 38-year-old textile worker developed chest tightness, cough, difficulty breathing mainly on the first day of the work week. This is the key point. First day. The symptom improve after several days from work. What is most likely diagnosis? So already in the first page, when I am explaining, briefing about different type of respiratory occupational hazards, I said very clearly, Monday fever is also called as what? Byssinosis. Those who are working in cotton or those who are exposed to cotton, flax, and hemp dust. Flax, hemp dust, these are all plants. Okay, so those who are working in cotton industry or textile industry, those who are frequently exposed to cotton, flax, and hemp, so for those people, they are going to get what? Byssinosis. Byssinosis is also called as what? Monday fever. Okay, already we discussed very clearly about silicosis, aspertosis, and the Former's law. Okay, the next one, question number 5. A 52-year-old man working in the sand blasting worker presents with progressive breathlessness. He has the history of silicosis. He now developed with a fever, night sweats, weight loss, persistent cough. Which investigation is most important to evaluate the suspected complication? From the symptoms, we can easily conclude that the patient is getting affected with Mycobacterium tuberculosis. Yes or no? Because fever, night sweat, weight loss, persistent cough is present, means these are all the symptoms of what? Mycobacterium tuberculosis. And already the patient got diagnosed with silicosis. Silicosis patient prone for what? TB, right? So for TB, what investigation we have to do? Option A is the right one. That is sputum examination for acid fast bacilli. So here the right answer is going to be what? Option A. Option A. That is sputum examination for acid fast bacilli is the right answer here. And what about other option? Serum IgE. This is used in the allergic condition. Right, and pulmonary function test to check the lung function. Serum calcium level, it is not at all related with this question. So at last, the right answer is going to be option A, that is sputum examination for acid fast bacilli. So these are all the repeatedly asked questions in the examination, and also we have listed all the important respiratory occupational hazards in the early of this discussion. So watch these videos again and again, very important. So many times they have asked questions related to occupational hazards. So if there is any doubts anywhere, you can drop your message in the chat box, and thank you very much for watching the video.